In today's class, we will discuss brachial plexus. Brachial plexus. It is a network of nerves which supply to the upper limb. How does it form? Formation. This brachial plexus, it is formed by ventral primary rami of C5, C6, C7, C8 and T1 nerves. So brachial plexus, it is formed by the ventral primary rami of C5, C6, C7, C8 and T1 spinal nerves. I will draw the diagram for this brachial plexus. So roots. So these are the root value of the brachial plexus. The roots. This is C5, C6, C7, C8 and T1. These roots, they unite to form the trunk. This C5 and C6, these roots, they unite to form upper trunk. C7, it remains alone and it forms the middle trunk. C8 and T1, it unites to form the lower trunk. So by these roots, trunks are formed. Then these trunks, they divide to form divisions. Each trunk divide into two branches, anterior branch and posterior branch. These are the posterior divisions and this is the anterior division. So each trunk divided into two branches, anterior division and posterior division. Then see, these divisions unite to form the cord. The anterior division of the upper trunk and middle trunk, they unite to form the lateral cord. The anterior division of the lower trunk, it remains alone and it forms the medial cord. The posterior division of all the trunks, these posterior divisions, they unite to form the posterior cord. So first understand the root value of the cords. The lateral cord, it is formed by the branches, by the division of upper trunk and middle trunk. So its root value should be C5, C6, C7. The medial cord, it is formed by the anterior division of the lower trunk, which is made up of C8 and T1 fibers. The posterior cord, it is formed by the fibers of all three trunks. So the root value is C5, C6, C7, C8, T1. So this is the root value of the posterior cord. Now these cords, they gives branches. So we will discuss what are the branches of these cords. So first of all, understand that we have to keep in mind roots, trunks, division, cord and branches. For that purpose we make a mnemonic and its name is RTDCB. RTDCB. It is ready to drink chilled beer. Clear? So this is the root and trunk. This is the supraclavicular part. Supraclavicular part of the brachial plexus. It is present in posterior triangle. Posterior triangle of neck. It is coming from the neck. Then D for division. This is the retroclavicular part. Retroclavicular part of the brachial plexus. It is present behind the clavicle. Then C and B part, I mean the cords and branches, this is known as the infraclavicular part of brachial plexus. This infraclavicular part, it is present in axilla. That is the infraclavicular part below the clavicle. Now the next point, the trunks, they are upper, middle and lower because they are coming from the neck. But the cords, they are lateral, medial and posterior. So on what grounds these cords are named as lateral, medial, posterior? This posterior cord, it is in relation to the axillary artery. Second part. It means the cord which is present behind the axillary artery, it becomes posterior cord. The cord which is lateral to the axillary artery, it is the lateral cord. And the cord which is medial to the axillary artery, that becomes the medial cord. So the cords are present in relation to the second part of axillary artery. Now the next point is the branches. What are the branches of the lateral cord? I will write here the lateral cord. Its branches. Root value of the lateral cord C5, C6, C7. The branches are lateral pectoral nerve. Second is lateral root of median nerve. Number 3, musculocutaneous nerve. So these are the 3 branches of the lateral cord. The root value of these nerves, the lateral cord, its root value is C5, C6, C7. Lateral root of median nerve C5, C6, C7. The musculocutaneous nerve C5, C6, C7. Now what muscles are supplied by lateral pectoral nerve? This lateral pectoral nerve, it's supplied to pectoralis major and pectoralis minor muscle. Both muscles belongs to the pectoral region of the chest region, supplied by the lateral pectoral nerve. Lateral root of median nerve, it's formed the median nerve. And the musculocutaneous nerve, it's supplied to the coracobrachialis muscle, the biceps brachii muscle, and the third muscle is the brachialis muscle. So 3 muscles are supplied by musculocutaneous nerve, and all 3 muscles belongs to anterior compartment. All 3 muscles, they belong to the anterior compartment of R. This brachialis muscle, it is also supplied by radial nerve. So that is why brachialis muscle is an example of hybrid muscle or composite muscle. Hybrid muscles are those muscles which are supplied by two nerves. So brachialis is a hybrid muscle, and these are the branches of the lateral cord of brachial plexus. Now the next cord is the medial cord of brachial plexus. Medial cord. What are the branches of medial cord? Its root value is C8T1, and the branches is number 1 medial pectoral nerve, number 2 medial root of median nerve, number 3 medial cutaneous nerve, medial cutaneous nerve of R, number 4 medial cutaneous nerve of 4R, and number 5 is ulnar nerve. So these are the branches of the medial cord. What is the root value of these nerves? Medial pectoral nerve, root value C8T1. Medial root of median nerve, root value C8T1. Medial cutaneous nerve of arm, root value C8T1. Medial cutaneous nerve of forearm, C8T1. Ulnar nerve, its root value is different, C7, C8T1. C7, C8T1, root value of ulnar nerve. Now see what muscles are supplied by medial pectoral nerve. It's supplied to pectoralis major muscle and pectoralis minor muscle. Then medial root of median nerve, it forms the median nerve. Medial cutaneous nerve of arm, cutaneous means it is the sensory nerve. Medial cutaneous nerve of forearm, it is also the sensory nerve of the forearm. Now the ulnar nerve. So one question arises, why this ulnar nerve has C7 fibers while it is the branch of medial cord? So what is the answer here? See the formation of median nerve. The answer comes from the median nerve formation. The median nerve is formed by the union of two roots, the lateral root of median nerve, and its root value is C5, C6, C7, and this is the medial root of the median nerve. Its root value is C8T1. These two roots unite to form the median nerve. So final root value of median nerve is C5, C6, C7, C8T1. This is the median nerve. This median nerve, this lateral root, it gives a branch which carry fiber C7. This is the ulnar nerve. Its root value C8T1, and then because it has arisen from the medial cord's root value C8T1. This lateral root of median nerve, it gives a branch which has the fiber C7. It unites with the ulnar nerve. So final root value of ulnar nerve changes. It becomes C7, C8T1. So what is the source of C7 fibers in the ulnar nerve? They are coming from the lateral root of median nerve. The lateral root of median nerve is giving the fibers C7. Now what muscles are supplied by the ulnar nerve? Ulnar nerve supplies the muscles of the forearm and hand. Now the next is the posterior cord of brachial plexus. The root value of posterior cord is C5, C6, C7, C8, T1. Posterior cord. Now, what are the branches of posterior cord? The branches of posterior cord The mnemonic for the branches of posterior cord is ulnar. This. So U4 upper subscapular nerve. L4 lower subscapular nerve. And for nerve 2 latissimus dorsal. A4 axillary nerve. R4 radial nerve. So these are the branches from the posterior cord. Mnemonic is ulnar. Now what are the root value of these branches? Upper subscapular nerve, its root value is C5, C6. Lower subscapular nerve, root value C5, C6. Nerve to latissimus dorsi, it is also known as thoracodorsal nerve. Thoracodorsal nerve, its root value is C6, C7 and C8. C6, C7, C8. Axillary nerve root value C5, C6. Radial nerve its root value C5, C6, C7, C8 and T1. C5, C6, C7, C8, T1. These are the root values of the nerves arising from the posterior cord. Now see this radial nerve. Radial nerve is the largest branch of brachial plexus. Why not the median nerve? The largest branch of brachial plexus is the radial nerve, but the median nerve has the same root value. See here, this median nerve also has the same root value C5, C6, C8, T1. Then why not median nerve is the largest branch? Because median nerve is not the direct branch of brachial plexus. It is formed by the union of two nerves of the brachial plexus, lateral root of median nerve and medial root of median nerve. Lateral root and the medial root, they unite to form the median nerve. So median nerve is an indirect branch of brachial plexus, while radial nerve is the direct branch of brachial plexus. Now the next point, what muscles are supplied by this upper subscapular nerve? It's supplied to the subscapularis muscle. Subscapularis muscle. Lower subscapular nerve, it's supplied to subscapularis plus teres major muscle. So two muscles are supplied by lower subscapular nerve. Nerve to latissimus dorsi or thoracodorsal nerve. It's supplied to the latissimus dorsi muscle. Axillary nerve, it's supplied to the deltoid and teres minor. The radial nerve, it's supplied to the muscles of the arm and muscles of the forearm. So these are the branches of the cords. Now we will talk about the branches from the trunks. Branches from upper trunk. As we have seen, this brachial plexus, it has three trunks: upper trunk, middle trunk and the lower trunk. So branches arise only from the upper trunk. First see this upper trunk. What is the root value of the upper trunk? The root value of upper trunk is C5, C6. The root value of the middle trunk is C7. The root value of the lower trunk is C8 and T1. The fibers which are forming the upper trunk, C5 and C6. So this upper trunk, it gives two branches. These are suprascapular nerve. And second branch is nerve to subclavius. Suprascapular nerve and nerve to subclavius. These two branches, they arise from the upper trunk. The root value of suprascapular nerve is C5, C6. Nerve to subclavius root value C5, C6. Now, what muscles are supplied by suprascapular nerve? It is supplied to supraspinatus, infraspinatus. Supraspinatus muscle, infraspinatus muscle. They are supplied by suprascapular nerve. Nerve to subclavius, it's supplied to the subclavius muscle. Now in the upper trunk, 6 nerves are meeting, and these 6 nerves meeting point is known as the AIIMS point. This is the first nerve, this is second nerve, this is third, this is fourth, this is fifth, and this is the sixth. So these 6 nerves, they are meeting at the upper trunk, and this meeting point is known as the AIIMS point. So this is the AIIMS point. So this point, this is known as the AIIMS point. So see the AIIMS point. The C5, C6 both unite to form the upper trunk, and then this upper trunk it bifurcates into 2 branches. This is the anterior division, this is the posterior division. Clear? So upper trunk root value C5, C6, and it gives 2 branches. These are the 2 branches. This is suprascapular nerve, and this is nerve to subclavius. So this meeting point, I am talking about this point, this is known as the AIIMS point. Injury to AIIMS point leads to AIIMS palsy. Injury to AIIMS point, it causes AIIMS palsy. What is the deformity in AIIMS palsy? Deformity is known as the policeman's tip hand. Or porter's tip hand. Policeman's tip hand or porter's tip hand is the deformity in AIIMS paralysis. What is the position of the upper limb in AIIMS palsy? See at this picture, this is the AIIMS palsy. This is the AIIMS palsy. Arm is adducted and medially rotated. Elbow is extended. This arm is adducted and medially rotated. Elbow is extended. Forearm is pronated. And wrist is flexed. So this deformity is the policeman's tip hand or porter's tip hand. I will write these deformities. How will the explanation of policeman's tip hand or porter's tip hand? So this is position of upper limb. This is number 1. Arm is adducted and medially rotated. Elbow is extended. Forearm is pronated. and wrist is flexed. So what movements are paralyzed in Erb's palsy? The movements which are written, they are present. They are not written, they are absent or paralyzed. Like arm is adducted, so adduction is possible. Adduction is present. What is not possible? Abduction is not possible. Medially rotated, so medial rotation is okay. The problem is in the lateral rotation. Lateral rotation is paralyzed. Elbow is extended because it cannot be flexed, so flexion is paralyzed. Forearm is pronated because supinators are paralyzed. Wrist is flexed because it cannot be extended, so extensors of the wrist are paralyzed. So this is the position of the upper limb. What nerves damaged? Nerves damaged in Erb's palsy. Nerves damaged in Erb's palsy. Nerves damaged with root value C5, C6. The nerves which have the root value C5, C6, they are damaged, like axillary nerve, upper subscapular nerve, lower subscapular nerve, nerve 2 subclavius, suprascapular nerve. So all these nerves which have the root value C5, C6, they are damaged, plus one more nerve, that is the musculocutaneous nerve. Musculocutaneous nerve is also damaged in Erb's palsy. Why? Because musculocutaneous nerve has the root value C5, C6, C7. But these C7 fibers, they supply to only coracobrachialis muscle. And it is a small muscle. Its action is also not very significant. Rest of the muscles, they are supplied by C5, C6, and these are two big muscles, that is the biceps brachii and brachialis. Both muscles are paralyzed. So that's why musculocutaneous nerve is also damaged in Erb's palsy. If question is asked what muscles are paralyzed, so all the muscles which are supplied by these nerves, they are paralyzed. The next point here, what is the cause of Erb's palsy? Number 1, birth injury or birth trauma, and the second is the fall on neck. The undue separation of the neck from shoulder causes Erb's palsy, and it happens either during delivery as birth trauma, in which condition, like shoulder dystocia. Shoulder dystocia. So the head of the baby has been delivered, shoulder has stuck, so undue pulling of the neck may cause Erb's palsy. Fall on the neck is also cause undue separation of the neck, so may cause Erb's palsy. Now the next is the injury to the lower trunk. Injury to lower trunk of brachial plexus C8 T1. This is the lower trunk. So injury to the lower trunk cause. Number 1, Klumpke's paralysis. Klumpke's paralysis. Number 2, it causes Hormone Syndrome. Klumpke's paralysis. What is the deformity in Klumpke's paralysis? Deformity is claw hand. Because C8 T1 nerves, they are dedicated to the intrinsic muscles of the hand, so they are paralyzed, which leads to the claw hand. What happens in the claw hand? Lumbricals are paralyzed. All intrinsic muscles are paralyzed, but the deformity appears due to the paralysis of lumbricals. So function of the lumbrical, that is the action of lumbrical, is reversed. What reversal? This is the extension at MP joint and flexion at IP joint. So these changes occurs, and this is the claw hand. Thumb is not involved. Because lumbricals are not working, not inserted at the thumb. So this extension and flexion do not occur at the thumb. So see the picture of claw hand. This is the claw hand. This is the claw hand. So this thumb is straight, but rest of the fingers, they are flexed. So flexion at the IP joint. This BIP joint, DIP joint, both are flexed, and this metacarpophalangeal joint, LP joint, it is extended. So this is the claw hand deformity. So because C8 T1 nerve, they supply to the intrinsic muscles of the hand, that is why the paralysis occurs in the intrinsic muscles of the hand. Now the next deformity in injury to the lower trunk, it is the Horner syndrome. So what are the other features of Horner syndrome? Horner's syndrome. The features of Horner syndrome is ptosis, meiosis, and hydrosis, and ophthalmos, and loss of cilio-spinal reflex. So ptosis means drooping of the upper eyelid. Meiosis, this is the constriction of pupil. Constriction of pupil. And hydrosis. And hydrosis is the loss of sweating. And ophthalmos, this is the sunken eyeball. And loss of ciliospinal reflex, it shows pinching at nape of neck. Nape of neck means the C7 spine. Cause dilatation of pupil. This is a normal reflex, and this reflex is lost in Horner's syndrome. This Horner syndrome, it occurs on the same side. It is a ipsilateral. The injury happens in which side of axilla? Same side of face is involved. So ipsilateral face is involved in the Horner syndrome. Why Horner syndrome? Due to injury of T1 sympathetic fibers. Because T1 nerve is damaged, C8 T1 injury happens at the C8 T1 nerve. So T1 nerve has two types of fibers, sympathetic fibers and somatic fibers. Somatic part damaged leads to claw hand, or this claw hand deformity, Klumpke's paralysis. While the T1 sympathetic component, when cut off, then it causes Horner syndrome. So this is due to the injury to the lower trunk. Now what are the cause of injury? Why this injury happens? The cause of injury is number 1, birth trauma. And the second cause is hand pulled in machinery. Hand pulled in machinery. This is the cause of injury. Okay. This. Now the next. Now we will talk the branches from root. After the branches from the cord, now the branches from the root of brachial plexus. Roots are C5, C6, C7, C8 and T1. So we have seen this. This is the upper trunk, middle trunk and the lower trunk. This is upper, middle and lower. So these are the roots and these are the trunks. So we have talked about the branches of the trunk. Now we will talk about the branches from the roots. This C5 root, it gives a branch which is known as dorsal scapular nerve. Then these three roots, C5, C6 and C7, these three roots, they unite to form long thoracic nerve. Long thoracic nerve C5, C6, C7. Dorsal scapular nerve, this is the C5. So see, this dorsal scapular nerve, it's applied to rhomboidus major, rhomboidus minor and levator scapulae. These muscles are supplied by dorsal scapular nerve. If injury occurs in the upper trunk, then dorsal scapular nerve will be spared because it arises proximal to the AIIMS point. This is the AIIMS point. So proximal to the AIIMS point, this nerve arises. That is why it is spared. Now three roots unite C5, C6, C7 to form the long thoracic nerve, and this long thoracic nerve gets supplied to serratus anterior muscle. Serratus anterior muscle. This is the long thoracic nerve. Serratus anterior muscle, this is known as the boxer's muscle. If long thoracic nerve is damaged, then what will happen? It leads to the winging of the scapula. Name of deformity is winging of scapula when long thoracic nerve is damaged. What is the winging of scapula? Medial border of scapula becomes prominent. During pushing and punching action. During pushing and punching action, this medial border of the scapula becomes prominent. What is the cause of injury to the long thoracic nerve? It is the carrying heavy loads on shoulder. This is the cause. Now the next heading is the radial nerve injury. Radial nerve injury. What are the name of injuries? Number 1, Saturday night palsy. Second is the crutch paralysis. So these are the name of two injuries which occurs due to the radial nerve injury. So question is like, which nerve is damaged in Saturday night palsy? It is the radial nerve. Which nerve is damaged in the crutch paralysis? It is the radial nerve. What is the site of injury? In both these types, site of injury is the axilla. Now, what is the deformity? Deformity is the same. It is the wrist drop, also known as the finger drop. Wrist drop or finger drop or thumb drop. So these are the same deformity. So what is the meaning of Saturday night palsy, or what is the difference between Saturday night palsy and crutch paralysis? In Saturday night palsy, an overdrunk guy resting on the chair and arm is hanging at the edge like this. So there is a pressure in the axilla which may cause injury to the radial nerve. So classically it is known as the Saturday night palsy. See this picture, this is the Saturday night palsy. This is the Saturday night palsy. So an overdrunk guy resting on the chair and arm is hanging at the edge. So there is pressure in the axilla. So the deformity, this deformity is the wrist drop. It is the wrist drop, finger drop, thumb drop, and this is the pressure in the axilla. And what is the crutch paralysis? Patient is walking with the help of crutches. So again, pressure and injury in the axilla. So that is the crutch paralysis. So now the question arises whether Saturday night palsy and crutch paralysis are they synonym or they different. Then if they different, then what is the difference in crutch paralysis and Saturday night palsy? They have the same nerve damage, same site of injury, same deformity, but they are different. And what is the difference? Difference is the grade of injury. Different is the grade of injury. Saturday night palsy, it is a superficial nerve injury known as the neuropraxia, while the crutch paralysis, it is the axontomasis and neurotomasis. So this is the difference, the severe grade of injuries, they are the crutch paralysis. In Saturday night palsy, it is a neuropraxia. So this is the superficial nerve injury. In Saturday night palsy, there is complete recovery. Complete recovery within 6 months. While in crutch paralysis, there is no recovery without surgery. This crutch paralysis. So it is a permanent paralysis. While Saturday night palsy, it is a temporary paralysis. So this is the difference between these two injuries. Saturday night is a temporary paralysis, while crutch paralysis, it is a permanent paralysis. Here is the treatment. Treatment is the nerve grafting. The damaged part of the nerve is removed and a healthy piece of nerve is connected. This is nerve grafting. Nerve graft is taken from sural nerve. Sural nerve, this is the branch of tibial nerve present in leg. So we take a healthy piece or a small piece of the sural nerve and connect it in the damaged nerve. What is the specialty of the sural nerve? Sural nerve is a stretchable nerve. That's why we are capable to take out a piece of this nerve, sural nerve. So this is all about the brachial plexus and the nerve injuries of the brachial plexus. Thank you so much.